Hello, my name is Dr. Uwais Khalid and today the topic of my lecture is oral ulcers. Ulcer is typically defined as any discontinuity in the continuation of mucosa. These oral ulcers are recurrent bouts of one or more round superficial painful ulcers. They are located in the buccal cavity and at several locations like inside of the lips, floor or roof of the buccal cavity, and on the tongue. Coming to the causes of oral ulcers, the most common cause is infection, which include bacterial infections like Borrelia vincenti causing Vincent angina, viral infection which include herpes simplex, and fungal infection like candidiasis. Multiple GI diseases also involve oral ulcers like Crohn's disease, ulcerative colitis, and celiac disease. Dermatological conditions which include oral ulcers are lichen planus, pemphigus, and pemphigoid. Several drugs are also cause of oral ulcers like Stevens-Johnson syndrome and cytotoxic drugs. Oral ulcers can be manifestation of multiple systemic diseases like systemic lupus erythematosus. Tumors which include oral ulcers are leukemia and Kaposi sarcoma. Coming to the classification of oral ulcers, there are two types of oral ulcers, minor and major. Minor oral ulcers are less than 10 mm in size and they heal without scarring. Major oral ulcers are more than 10 mm in size and heal with scarring. Painful stage of oral ulcers lasts 7 to 10 days and healing is completed in 1 to 3 weeks. This point is very important regarding the clinical practice. I have seen sometimes the patient come back after 3 to 4 days and complain of not recovering from oral ulcers. So we have to counsel the patient and reassure the patient that these oral ulcers, the painful stage lasts 7 to 10 days and healing is completed in 1 to 3 weeks. Differential diagnosis. Among differential diagnoses of oral ulcers, following diseases lies: Crohn's disease, ulcerative colitis, celiac disease, systemic lupus erythematosus, drug allergy, more specifically the Stevens-Johnson syndrome, herpes simplex, and pemphigus vulgaris. In Crohn's disease, the oral ulcers resemble the common canker sore. Systemic lupus erythematosus, 45% of people have oral ulcers as manifestation of systemic lupus erythematosus. In herpes infection, painful sores on lips, gums, tongues, and roof of your mouth appear, and it also can cause symptoms such as fever and muscle ache. So coming to the treatment of oral ulcers, number one, we give the patient local anesthetics like available in Pakistan Bonjela gel, Somo gel, and Zalocaine gel. Mouthwash are also recommended like Listerine gargle and have which contain chlorhexidine containing mouthwash was able to kill all strains of Candida albicans. Short course of systemic steroids can also be given to the patient. Azathioprine can be tried in several cases, in severe cases. Antibiotics like ciprofloxacin and metronidazole can also be prescribed, and antifungal drops like Nilstat oral drops are also given to the patient. Thanks for watching the lecture. If you like this video, please like, subscribe, and share.